the role with psychology is to think about ways we can help you to cope better and to help you to manage that pain. So it's not pain cure, it's pain management, but also the emotional response of that, and to help you to cope with your mood, the anxiety, loss of confidence, the impact it may be having on other areas of your life. So lots around adjustment and loss, coping strategies, but sometimes it may also be looking at how you think and the thoughts that come with that. So maybe you may be avoiding certain things because of fear of pain, or you may be having a belief that if I do this, I may be causing more damage, or beliefs around things, I've always got to cope, or I've always got to be a certain way. So we really unpick that. And some of those beliefs and thoughts may have come back from way back, so we can really understand whether if someone's always used exercise as a way of coping and pain stopping them, they actually need other coping strategies to cope. Cognitive behaviour therapy, also known in short as CBT, is the predominant model there's been a lot of work from the government, a national drive for accessing psychological therapies at primary care and community level. So there's a lot of evidence-based, nice guidance, evidence-based around, and also the British Pain Society, a lot of evidence around that for cognitive behavioural model for pain management. It's one model. There's also been other models that are very highly regarded. A newer model, acceptance and commitment therapy. I'm not trained in that, but some of the principles we do use because it's around adjustment and acceptance. I also work around using a lot around sort of grief models and loss and adjustment, because people are changing from being the old them to having to work and live with the new person with maybe limitations due to the pain. I'm cat trained, so that's not furry animal cats, although I do love them. It is cognitive analytic therapy, so that's very much an integrative therapy which incorporates cognitive behaviour therapy, but also more other longer term therapies looking at sort of relational elements. So people may be going through repeating themes that they may have repeated. They've always maybe been the perfectionist and they're somehow doing that now in managing their pain. So it can really be helpful at looking at different ways of coping, if you can understand maybe how the past has influenced on how they're coping and managing things now. So often I may use that occasionally with people with more complex cases, where we may be getting a bit stuck as well as a team, and thinking about how we can help that person move forward, or the patient's feeling stuck.